If you're over 60, stop blaming every change in your legs on getting older, because cold feet, unexplained heaviness, numb toes, swelling, or pain when you walk may be telling you something your body wants you to notice. And here's the part that surprises many people. Your legs can sometimes reveal changes in your health before you realize anything is happening. Maybe you wake up and your legs feel perfectly normal. Then by evening, they feel heavy. Maybe one foot seems colder than the other. Maybe you get that pins and needles feeling in your toes. Or maybe you notice something even more specific. You walk for a while, your calf begins to hurt, you stop and rest, and the pain disappears. Then you start walking again, and it comes right back. That's not something you should automatically dismiss as just getting older. Some of these changes can have simple explanations. Others can be connected to your nerves, muscles, blood vessels, or circulation. So today we're going through 6 warning signs in your legs that deserve your attention after 60. And stay with me until number 1, because the final sign is one you should never casually ignore when it appears suddenly. But before we get into it, I want to know who's watching. Tell me your age and the country you're watching from in the comments. Are you watching from the United States, Canada, the United Kingdom, Nigeria, Australia, or somewhere else? I genuinely want to know how many people in our healthy living community are learning this together. Now let's begin. Number 6. Your legs feel heavy for no obvious reason. Think about how your legs feel when you first get out of bed. For many people, they're fine in the morning, but after several hours of standing, walking, or sitting, something changes. Your legs start feeling heavy. Your ankles may look a little fuller, your socks may leave deeper marks than usual, or you may feel like your legs are simply tired before the rest of your body is. Now, having tired legs after a long day isn't automatically a problem. Your muscles work all day. Of course they're going to get tired. But when heaviness or swelling becomes persistent, keeps returning, or is noticeably different from what you've experienced before, it's worth paying attention. One reason movement matters is that your calf muscles help support the movement of blood from your lower legs back toward your heart. Think of your calf muscles as part of a natural pumping system. Every time you walk, those muscles contract. But when you sit for several hours without moving, that muscle activity decreases. That's why one simple habit can make a difference to your daily routine. Don't let hours pass without moving your legs. Stand up when you can, walk around your house, take a short walk outside if it's safe for you, or gently move your ankles while sitting. You don't have to turn your day into an exercise program. Sometimes the first step is simply not staying completely still for hours. But heaviness isn't the only change you should watch. There's another one that's even easier to overlook. Number 5. One foot is colder than the other. Here's something you can notice without any equipment. Sit down tonight and pay attention to both feet. Do they feel approximately the same? Or does one feel noticeably colder? Cold feet by themselves don't automatically mean there's a circulation problem. Maybe the room is cold. Maybe you've been sitting still. Maybe you've just walked across a cold floor. But if one foot repeatedly feels colder than the other, especially when you're in a warm environment, don't completely ignore it. Your blood carries oxygen and heat throughout your body. A significant reduction in blood flow to a leg or foot can sometimes cause that area to feel unusually cold, and the situation becomes more concerning when coldness appears alongside other changes. Numbness, weakness, pain, pale or bluish skin, or a noticeable difference between one foot and the other. This is why you shouldn't focus on one symptom in isolation. Look at the whole picture. Temperature, color, sensation, pain, movement. Your legs are giving you information. The question is whether you're paying attention. And if you're finding this useful so far, tap the like button for me. It helps more people over 60 find practical health information like this. And if you're new here, subscribe to Healthy Living, because we focus on simple health information that can help you understand the changes that come with getting older. Now let's move to number 4. because this one has a very specific pattern. Number 4. Your leg hurts when you walk, then feels better when you rest. Imagine you're walking through a shopping center. Everything is fine for the first few minutes. Then you begin feeling an ache or cramping in your calf. So you stop. You stand there for a few minutes, and the discomfort improves. You continue walking, then it happens again. If you've noticed this repeatedly, don't automatically assume you're simply out of shape. A predictable pattern of leg pain during activity that improves with rest can sometimes occur when the muscles aren't receiving enough blood flow during exercise. One condition doctors may evaluate for is called peripheral artery disease, or PAD. PAD occurs when arteries supplying the legs become narrowed or blocked, often because of plaque buildup. When you're resting, your muscles don't need as much oxygen. But when you start walking, their demand increases. If blood flow can't increase enough to meet that demand, discomfort can develop. And when you stop walking, the demand falls again. That's one reason the pain may improve with rest. But remember this, not every leg pain is PAD. Arthritis can cause pain, nerve problems can cause pain, muscle injuries can cause pain. Problems coming from your back can also cause leg symptoms. So don't diagnose yourself from a video. Instead, recognize the pattern and tell your healthcare professional what you've noticed. Sometimes the details you think are unimportant are exactly what help them figure out what's happening. And now we're getting to a symptom many people simply learn to live with. Number 3. Your toes keep going numb or tingly. You know that feeling when your foot falls asleep? Pins and needles. A strange buzzing sensation, maybe a little numbness. Then you move around and it disappears. That occasional experience can happen to anyone, but recurring or persistent numbness deserves more attention. There can be many causes: nerve problems, diabetes-related nerve damage, certain medications, nutritional problems, back or spinal issues, and sometimes circulation problems can also be involved. So instead of simply asking, "Why are my feet tingling?" start asking better questions. Is it happening in both feet? Or only one? Does it happen when you're walking? When you're lying down? Does it come with weakness? Is the foot also cold? Has the skin changed color? Those details matter. And if you have diabetes, foot sensation is especially important to monitor because reduced sensation can make it easier to miss cuts, blisters, burns, or wounds. So make checking your feet a small daily habit. Look at the tops, look at the bottoms, check between your toes. Look for cuts, blisters, swelling, cracks, sores, or changes in color. Your feet don't have to look perfect. They just need to be noticed. And number 2 is something you can see without feeling anything at all. Number 2, your skin, toes, or nails start looking different. Take a look at your feet, not your shoes, your feet. Has the skin become unusually pale? Does part of the foot look bluish or darker than usual? Are your toenails changing? Is a small wound taking much longer than expected to heal? These changes can have many explanations, so don't assume that every nail or skin change means poor circulation. But when these changes appear together with coldness, numbness, pain, weakness, or swelling, it's worth getting them evaluated. Your skin and nails depend on a healthy supply of oxygen and nutrients. And when blood flow to tissues is significantly reduced, healing can become more difficult. That's why a wound that simply refuses to heal deserves attention. Maybe it's a tiny cut, maybe a blister, maybe a sore you barely noticed. Days pass, then more days, and it's still there. Don't keep covering it and hoping it disappears if it's not improving normally, especially if you have diabetes or other cardiovascular risk factors. Get it checked, because sometimes something that looks small on the outside deserves a closer look. And now we're at number 1. This is the one I really want you to remember. Number 1. One leg suddenly looks or feels different. This isn't about a change you've had for years. I'm talking about something new and sudden. One leg becomes noticeably swollen. One leg becomes painful or tender. The skin becomes warm or red. Or the leg suddenly looks very different from the other one. Don't experiment with that. Don't assume you simply slept in the wrong position. And don't aggressively massage a suddenly painful or swollen leg while hoping it goes away. Sudden swelling and pain in one leg can sometimes be associated with a deep vein thrombosis, commonly called a DVT. A DVT is a blood clot that forms in a deep vein, and if part of that clot travels to the lungs, it can become life-threatening. That's why symptoms such as sudden difficulty breathing, chest pain, coughing up blood, fainting, or severe unexplained symptoms require urgent medical attention. There's another emergency sign you should know. If a foot suddenly becomes extremely cold, pale, blue, severely painful, weak, or numb, that can signal a serious reduction in blood flow. Don't wait several days hoping a drink or home remedy will fix it. Get urgent medical help. This isn't the moment for a teaspoon of anything, it's the moment to find out what's happening. So, what can you do to support healthy legs? Here's the good news. Supporting your circulation doesn't require a magical ingredient. It starts with the basics. Move regularly. Don't sit completely still for hours. Walk at an intensity that's appropriate for your health. Stay adequately hydrated, unless you've been told to restrict fluids. Eat a balanced diet that supports your heart and blood vessels. Don't smoke. Keep your blood pressure under control. Know your cholesterol and blood sugar numbers. And if you have a medical condition that affects your circulation, follow the treatment plan you've been given. Most importantly, learn your normal. Know what your feet normally look like. Know what they normally feel like. Know how far you can comfortably walk. Know whether both legs usually feel about the same. Because when you know you're normal, it's much easier to recognize a meaningful change. And that brings us to the biggest lesson from today's video. Getting older is not a diagnosis. Yes, your body changes as you age. Your muscles can become weaker. Your joints may become stiffer. Your recovery may take longer. But a new symptom shouldn't automatically be dismissed because you're 60, 65, 70, or older. If something has changed, pay attention. It may be harmless. It may have a simple explanation, but sometimes catching a problem early gives you the opportunity to deal with it before it becomes more serious. So tonight, take 1 minute. Look at both feet. Look at your ankles. Notice the color. Notice the temperature. Notice how they feel. Then ask yourself, does one side look or feel noticeably different from the other? If everything looks normal, that's useful to know. If something has recently changed and it's getting worse, don't ignore it. And before you go, I want you to do one thing for me. Comment below with your age and tell me which of these 6 signs you've noticed: cold feet, heavy legs, numbness, pain while walking, skin or nail changes, or swelling. Your comment may also help us know which topics you want us to cover next. And if this video gave you information you didn't know before, subscribe to Healthy Living and turn on notifications. We have many more videos coming for adults 45 and over about circulation, blood pressure, heart health, and the everyday changes we sometimes overlook. Because your body doesn't always shout when something changes. Sometimes it whispers. And the people who learn to listen to those whispers may catch important changes sooner. Take care of your legs. Take care of your heart. And most importantly, don't blame everything on age.